Okay, thank you everyone for tuning in to this video interview with Dr. Jonathan Weinkle of Squirrel Hill Health Center. I'm Judd Mellinger-Blouck. I'm director of the Pennsylvania Primary Care Career Center, and I'm really happy to be here with Dr. Weinkle. He is both a physician and an author, and here's his book, Healing People, Not Patients. And you can find out more about him on his website, www.healerswholisten.com. Dr. Weinkle is double board certified in internal medicine and pediatrics. He lives in Pittsburgh with his wife and three sons, and he grew up there and went to medical school there. And he's as you can tell by the Penguins poster in the background, he's a true Pittsburgh fan. So, Dr. Weinkle, it's really great to have you here this morning.
Thanks a lot, Judd. I appreciate being here.
You bet. You bet. Let's start with the first question I want to ask you is, what drew you to working in a community health center and specifically Squirrel Hill?
Yeah, thanks. So there's a couple of different things that got me there. One is that, MedPeds is an interesting hybrid. Um, when you train, as I did in both internal medicine and pediatric, I had a really strong desire to work with the full spectrum of ages. Um, and there are places in the country where that's really easy to do. Places further west in Ohio and Michigan and so forth, where med peds doctors really do take care of the full spectrum of ages. Places out west where family physicians really have a complete mix. And unfortunately, the further east you go, and the further you get towards the New York metro area, and Pittsburgh is sort of in that penumbra. Um, Even in designated family practices, there's not a lot of true cradle to grave care, or even pre-cradle to grave care, womb to grave care. Um, and Squirrel Hill Health Center offered me one of the few opportunities when I was interviewing to do pediatrics and internal medicine in one place for one employer, not to have to split myself in two and then be dealing with competing responsibilities. So it was partially to satisfy my really strong desire to do full age spectrum primary care. Um, but I also really wanted to go into care for the people that needed it the most. I wanted to reach the people who didn't have such an easy time getting to the doctor, didn't have such an easy time accessing resources. Um, I didn't want to be on the corporate productivity train. I didn't want to be um, on the kind of procedure incentivized um, pat pattern or model that I knew was out there, and that I talked about in a lot of my other job interviews. And Squirrel Hill seemed like the perfect place. It was brand new. They were growing. There was room for me to fit right in and start doing what I wanted to do. I had rotated there as a resident, and it was in my home neighborhood. It was the perfect.
Great. Was that, what you said about things you heard about in your job interviews, at least to my second question. And how do you feel working in a community health center is different from working in, say, a practice owned by a large health system
Mhm.
or privately? Or not that there's anything wrong with those models, but how are they different?
Right. So one of the differences is that community health centers, and I mean I have an N of one to experience, but it's a great N. Community health centers are very mission driven, and each mission is slightly different. Our mission, I'm not going to quote the entire mission statement, but one of the things that it speaks to specifically is care to ethnic, linguistic, cultural, religious minorities, care to people of all socioeconomic backgrounds, care to people who are dealing with substance use disorders and trying to navigate recovery and sobriety, um, care to people who have inability to pay due to lack of insurance, and making sure that we are always there for those people, regardless of what circumstances have sprung up in their way. Um, and I mean, my patient population, in any given day speaks to the success of our center in meeting that mission. Um, One of the things that keeps us on mission is that our board is by law, by the law that created the community health centers half a century ago, um, 50% plus one of people who are patients of the health center. So, if you talk about patient-centered care, the health systems can talk about patient-centered care all they want, but the health systems are run by executives. The private ones are run by shareholders. The academic ones are run by universities. And our health center is run by an executive and a medical director who are serving with the full consent and approval of a board made up of the people they take care of. Not exclusively, but the other people on the board are community members who have an interest in seeing us succeed. So this is really care for the people that we want to take care of, with the input and approval of those exact populations.
Great, great. So my third question is probably the most difficult question I'm going to ask you,
Mm-hmm.
and that is, what's a day like at your practice?
Sure. So I've taken, I think probably my first or second year in practice, I started saying this, but it has never changed in the 12 years that I've been working there. And really not since I started med school, but I am never bored. I have not been bored since high school. And to have a career where you're never bored is really pretty remarkable. I may be frustrated, I may be exhausted, but I am never bored. Every day is different. I feel like because of the resource challenges that our patients have, we take care of a much wider variety of things in our practice than you normally would in primary care. We're not a referral machine. We are, to use terms from emergency medical services, we are not a scoop and run, we're a stay and play. And the opportunity to think about difficult diagnoses together, the opportunity to do some procedures that would normally be rubber stamp refer. And also the opportunity to see things that you wouldn't normally see, and really help people make some dramatic changes, because many of our patients are coming from environments that are even more resource poor than wherever they happen to be right now, because they're coming from other countries, they're coming from war zones, they're coming from refugee camps, and they have sicknesses that we've sort of forgotten about in the United States, or not really seen. And sometimes little simple things. I remember one case in particular, a gentleman that I met very early on, who was one of the earliest refugees from overseas that I took care of, who was terribly ill, and one diagnostic test for Helicobacter pylori, which is the bad actor that causes most of our stomach and duodenal ulcers. And 14 days later, and he felt completely better, and he hadn't felt that good in 6 or 7 years since he got infected. But he had, there was no way of diagnosing it, let alone the ability to treat it. And we've had lots of those cases. We've diagnosed people with leprosy. We've diagnosed people with all sorts of different things, and been able to provide them treatment that they couldn't get before. By the same token, we've also been able to connect people with buprenorphine treatment for their substance use disorder. And I want to say that we were at the early edge of the sort of non-punitive, non-time limited model of saying buprenorphine can be a drug like metformin. You take it for your substance use disorder like people take metformin for their diabetes for years, and it helps you to function normally in life. And seeing people at their third, fourth, fifth year of sobriety, or the work that we do with the Power organization for women in recovery, even dating back to before we were prescribing buprenorphine, it's really pretty amazing to see all of those things. And to go back to the question that you asked, which is what's a typical day like? A typical day is all of those things, and some routine well-person checks for people who live in the neighborhood who could go anywhere, but come to us because we're a little less rushed. We have this whole person perspective. With it changes what you're able to do in a given day.
Oh, that's great. Can't get through an interview in 2020 without asking you how the pandemic has impacted Squirrel Hill, how it's impacted your practice of medicine, and most importantly, how has it impacted your patients?
Sure. So one of the things that I have to commend my leadership on again is their sort of nimble approach to the pandemic. We went from Friday the 13th of March having a fully open office where I was with 5 clinicians and another one halfway across town with 4 clinicians and a full schedule of people and lab work and everything like that, to Monday morning, I saw 3 patients who I couldn't get a hold of in time. And Tuesday, I was completely virtual and doing all of my visits over the phone. And within a week, we had a Zoom contract. We had worked out the legalities and the payment to some degree. And they said, if we're not still ready to get paid, we're going to do telehealth anyway until we figure out how to get paid. And then we'll just backlog it and bill it later because we need to see people. So in terms of our ability to adapt, I think it was wonderful. And that's actually, I think, partially credit to being a smaller organization that is mission driven. And if the mission is we've got to provide services somehow, but we've got to do it in the safest way possible, we were going to figure out how to do it. And sometimes it feels slow until you think about how much slower it is when you've got a much bigger chip to turn around. But that's not to say that it hasn't been without challenges. As you might imagine, dealing with when you're working with people who have healthcare resource challenges, they also have technology resource challenges, people who have language challenges and who are coming from pre-industrial societies, working with video conferencing, working with text messaging and email and things like that that you and I find sort of second nature. We're working with our older US-born patients who are digital immigrants, as my cousin Rabbi Jeff Shine likes to call them. He's a student of the shift to social media technology and things like that, and refers to people his age, because he's in his early 70s, as digital immigrants. So whether you came from this physical location but a different generation, or you came from somewhere else entirely, it's hard to adapt to that. So being able to video conference with someone where they're not clear on the technology, being able to video conference with someone who understands the technology but doesn't have it, who doesn't have good internet service. We're running into the same challenges that the schools are. It's gotten progressively better, and the clinicians have gotten progressively better at figuring out, well, if somebody doesn't show up, how am I going to track them down? How am I going to loop them in? How am I going to make the most of this conference? We've had to learn how to do physical exams over Zoom. And there's great resources out there on the web from a lot of the professional societies, from the American Academy of Neurology and from the allergy and immunology people and various other folks from Cleveland Clinic that kind of teach you how to do that. We've dove into the little bit of extra funding that we got from HRSA to be able to get blood pressure cuffs for people to check their blood pressure at home. We've done all these sorts of things. There is a frustration point that we've hit with people saying, look, I really need to come in and see you. There's things that we need to do. And it has been a real challenge to get the office back open, back up and running partially, while still continuing to be appropriately cautious. It's taken a long time to get dental going. It's taken a long time to get everything done. But basically saying, what do we have to do first? Well, the first thing we have to do is we have to get the OB running back up and running. Okay, now what do we have to do next? We have to make sure we're vaccinating the kids. And each piece comes back online as we think we can do it safely. And, some of the telehealth won't ever go away, because if I have to follow up somebody's blood pressure medicine 4 weeks later, and it's going to take me 10 minutes, why should that person waste 3 hours out of their day getting on 2 buses, coming to my office, sitting in my waiting room, seeing me for 15 minutes, and then going back, when we can interrupt their workday wherever they are? They can put on a pair of headphones, slap on a blood pressure cuff, and I know exactly what I need to do in 10 minutes, and they can go back to what they were doing. Those kind of things will continue. Behavioral health will probably continue a lot of online. And I think that we've figured out how to do all of those things in combination. And, the kinks that still have to be worked out will have to be worked out. We might, someday we might even move off Zoom to something that was actually made for doctors.
Right. Yeah, that'd be great. So one last question, and take your time answering this, but
that's okay. I'm sipping from my Kermit the Frog mug. This is the other thing, is that working at a federally qualified health center enables me to let my inner Muppet come out and share with my coworkers. I also have a T-shirt that says, "I understand the Muppets on a much deeper level than you do." So
That's
just so
great.
you know where I'm coming from.
That's great. That's great. We'll have to talk about that because, yeah, anyway, that's great. I love it. I love it. And, one of the things just quickly, one of the things I love about working with community health centers is the sense of humor that people bring to their job,
Yep.
because you can really be who you are. It's not trying to fit into some kind of mold. You can really you can be Jonathan Weinkle, I can be Judd Mellinger-Blouck, and,
Right.
it's great. Anyway, so, speaking about you, at one point in your career, you, I think, pretty seriously were considering a career as a rabbi, um, and and I know you're still very involved in your religious observance and your faith. So, how does your work as a physician at Squirrel Hill kind of reflect your faith and help you live out, your calling?
So so Judaism sort of works on a system of mitzvot, which is often translated as commandments, meaning something that God ordered somebody to do. And if you, depending on whose interpretation you follow, you could say, I mean, the first commandment was probably let there be light, God commanding God's self to make light. But one of the earliest commandments in the first chapter is let us create humanity in our image, right? Let's make human beings in the divine image. And that's a concept that really spans most, I won't say all, because I mean, you can never be completely exhaustive, but most world religions. Um, and I talk about this a little bit in the first chapter of the book. And it's kind of reflected in one of the versions of the graphic that's on the cover, that um, when you have when you look at whether it's Judaism or Christianity or Islam, Hinduism, even the humanistic stream within medicine, the Arnold P. Gold Humanism Society, which is a non-faith-based group that sort of promotes humanitarian values in medicine. They talk about a human being as an infinitely valuable end into themselves. Christianity, a lot of denominations of Christianity talk about people as being some of God's children. Um, I've heard a translation of the Sanskrit word namaste as being the God within me salutes the God within you. And if you're going to greet a person like that, that means that you value them as more than a client or a patient or a um, or a recipient of services, whatever it is. That you refer to them as a person with diabetes instead of a diabetic, or a person with cystic fibrosis instead of a cystic. Um, it changes your whole perspective on things. So um, I think that community health centers in general, and Squirrel Hill Health Center in particular, um, have set up care to look at that and to say, what do you, this person who I'm talking to, what do you need? How can I help you? Not how can I adjust your numbers, or how can I, make sure that our population statistics look good. We keep statistics because keeping statistics is a way on the global level of making sure that people on the individual level are getting the right care. Making sure that we have, 0 patients presenting over a quarter of the year for, OB care late in their 3rd trimester is good care, because the person that does present that late is at much higher risk for having a complicated delivery. It's having much higher risk for not having a healthy baby. We want to avoid that. So, but those big statistics are to serve the individual people they represent. Um, and what's been nice is I've been able to be me and have my religion and my needs. We get floating holidays, so that you don't necessarily take off the days that we say these are the holidays we care about, but you take off the days that are most important to you.
Right.
um, and when we have our holiday party, we actually have, I won't sing it for you, but there was because it's out of season, but there was one year where I decided to take one of the traditional Hanukkah songs and make it into a parody song about all of the different holidays that we celebrate. And I mean, we managed to get in Dia de los Muertos, and we managed to get in Nowruz, which is the Persian New Year, and Deepawali and Christmas, and American New Year's, and it's we value each other, we treasure each other, um, we give each other space, and I think that all ends up coming back to valuing and treasuring the people we take care of too, and giving them the space to heal and get well and stay well while also fasting for Ramadan or observing a 13-day period of mourning for their relatives, if that's the way that their faith tells them that they need to do it, or not observing any faith at all because they feel that they've been estranged from it.
Right.
That's not our job. Our job is to treat everybody with respect.
That's great. Dr. Weinkle, that's all I had today. There's so much more we could talk about for hours and hours. And I've enjoyed this. I hope the people who view this, and anything you want to say in closing?
Um,
I kind of threw that at you.
you didn't tell me I was going to need to make closing remarks.
No, you don't need to, but I want to give you that opportunity.
I mean, I think what I've said speaks for itself.
Yeah,
But
cool.
you know, we're in a period of tremendous upheaval. Anywhere that you go to work in medicine at this point, there's going to be, it's going to feel like the sky is falling. If you work in a community health center, you will feel somehow like you are surrounded by people who are committed to putting the sky back up. And I think that's probably the best endorsement I can give it.
On that note, which is quite profound, we'll say thank you. And Dr. Weinkle, thanks for all you do, and have a great day.
My pleasure.
Okay, thank you.